Hi everyone. In today's clip, I will talk a little bit about Lyme disease. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So Lyme disease is an illness caused by Borrelia bacteria. A person usually gets Lyme disease from a tick bite carrying the bacteria. A tick bite may look like a tiny itchy bump on the skin, much like a mosquito bite. This doesn't mean you have a tick-borne disease. Many people will not even notice they've had a tick bite. Ticks feed on blood by attaching to a host's skin. The tick feeds until it's swollen, and many times its typical size. Deer ticks, for example, can feed on host's blood for several days. A tick picks up bacteria from a host, like a deer or a rodent. They don't get sick, but they can sort of pass the bacteria to another host. When an infected tick feeds on a person, the bacteria can move to the person's bloodstream. The bacteria are less likely to spread Lyme disease if you remove the tick within 24 hours. Early symptoms of Lyme disease usually happen within 3 to 30 days after a tick bite. This stage is called early localized disease. The person will see a rash, which is a common sign of Lyme disease, but it doesn't always happen. The rash is usually a single circle that slowly spreads from the site of the tick bite. It may become sort of clear in the center and look like a target or bullseye. The rash then often feels warm when you touch it, but it's usually not painful or itchy. Other stage 1 symptoms can include things like fever, headache, extreme tiredness, joint stiffness, muscle aches and pains, swollen lymph nodes, and so on. So without treatment, Lyme disease can get worse and get to the stage 2. The symptoms often show up within 3 to 10 weeks after a tick bite. Stage 2 is often more serious and widespread. It's called early disseminated disease. Stage 2 may include the stage 1 symptoms plus more, like many rashes on other parts of the body, neck pain or stiffness, muscle weakness on one or both sides of the face, immune system activity in heart tissue that causes irregular heartbeats, pain that starts from the back and hips and sort of spreads to the legs, pain, numbness or weakness in hands and feet, painful swelling in tissues of the eye or eyelids, immune system activity in eye nerves that causes pain or vision loss. So after this, in the third stage, the person may have symptoms from the earlier 2 stages and other symptoms added to it. This stage is called late disseminated disease. The most common condition of this stage is arthritis in large joints, particularly in the knees. So pain, swelling, and stiffness may last for a very long time, or the symptoms may come and go. Stage 3 symptoms usually begin 2 to 12 months after the tick bite. In conventional medicine, Lyme disease is primarily treated with antibiotics. Early treatment with oral antibiotics like doxycycline, amoxicillin, or cefuroxime is usually effective. For more severe or persistent cases, intravenous antibiotics may be also used. While most people recover fully with appropriate treatment, some may experience lingering symptoms after treatment, which may require supportive therapies. Also, there is something called phage therapy. Phage therapy is generally considered safe because phages, which are viruses that infect bacteria, are highly specific and do not harm human cells. They target and kill bacteria, not human tissue, which is a key reason for their low-risk profile. Phages are designed to target specific bacterial strains and don't have a broad host range like many antibiotics. This specifically helps minimize the risk of harming beneficial bacteria in the gut or other parts of the body. But I'm not sure if this is actually FDA approved in North America and needs a bit more looking into. In orthomolecular medicine, the treatment is really individualized, but in general, for acute Lyme disease, usually the patient will receive several infusions of vitamin C. The first infusion would be around 100 milligrams, followed by 5 more infusions of 50 grams, each given over a period of 2 days. Patients have seen complete wellness over 72 hours period with no relapse. For chronic Lyme disease, usually they receive infusions of 25, 50, 75, and 100 grams of vitamin C. Then for 19 more days, they receive 5 or 6 infusions weekly of 100 grams of vitamin C in each infusion. The duration of these infusions are usually different per individual. Some may see sooner and some may see results a bit later. Once the patient feels well, they normally continue another week of 100 grams of daily infusions to be sure that the condition is truly resolved and it's not going to come back. It is to be noted that any bacterial infection will benefit from us cleansing our lymphatic, flourishing our gut microbiome, as well as consuming garlic, honey, ginger, clove, oil of oregano, or black walnut. Two most potent extracts that were successfully used by patients to heal the ailment were extracts from Ghanaian quinine and Japanese knotweed. Now, Ghanaian quinine, also known as yellow dye root, is a herbal extract derived from a shrub native to West Africa. It is traditionally used in Ghanaian medicine for treating conditions like malaria, hepatitis, septicemia, and tuberculosis. The active compound in Ghanaian quinine is an alkaloid with antimicrobial properties. Studies have shown that extracts from Ghanaian quinine can kill the bacterium causing Lyme disease, even at low concentration. And there are articles on this on National Health Institute, or NIH, backing this up. Japanese knotweed also has been used in traditional medicine for centuries and may offer potential health benefits, particularly due to its high content of resveratrol. This has an antioxidant, anti-inflammatory, and antiviral properties. Metaphysically speaking, Lyme disease can be seen as a blockage or imbalance in body's energy channels or chakras, leading to a weakening of immune system and making the body more susceptible to infection. Metaphysical approaches to healing Lyme disease include practices like meditation, yoga, spiritual retreats to restore balance and energy flow. Symptoms are signals from our intuition that we are not listening and that we're not following our path, that things need to change. When we don't listen to our intuition, or we have trauma of some sort that isn't properly processed, our feelings are pushed down into our body and are transformed into pain, inflammation, addiction, infection, cell growth that doesn't belong, weakened immune system, fatigue, and more. Hope this has been helpful. Like and follow for more. Be the light.